name is Rizumi Kavar, and I'm going to be doing my injection checklist. So today, first I'm going to go ahead and prepare my syringes to be injected into my client. I'm going to go ahead and wash my hands. And so I already have my materials. I have my 3C syringe. I have my 2 tuberculin syringes. I have my 3 spare needles. I have my cotton swabs, wet and dry. I have my micropore tape. I also have a fruit like my orange, and I have my vials of medication right here, and I also have a sharps container to discard the sharps. So first what I'm gonna go ahead and do is I'm gonna start with the 0.5 tetanus toxoid. So I'm gonna go ahead and take my 3cc syringe. I'm gonna take a spare needle. Go ahead and put it aside. I'm gonna get 0.5 of tetanus toxoid. Okay, now that I have 0.5, I'm gonna go ahead and move this needle. I'm going to place it into my sharps container, and I'm gonna put in the new one to be injected into my client. Alright, and then now I'm gonna go ahead and do my insulin. I'm gonna get 0.3 of my insulin, and I have my tuberculin syringe, so I'm gonna go ahead and get 0.3. Okay, 0.3. I'm gonna go ahead and cap it, and then I'm gonna go ahead get my other tuberculin syringe, and I'm going to do my antibiotics. I'm gonna be using cefuroxime. So I'm going to be also diluting that with my sterile water. So I'm gonna go ahead and get 0.9 of my sterile water. Okay, and I'm also gonna get my cefuroxime. Just 0.1. All right, I'm gonna go ahead and cap that as well. All right. Now I am ready to go. I have my 3 syringes to be injected into my client. Hello, my name is Rizumi Kavar, So this is my client, Mrs. Juice. So your name is Orange Juice, correct? Okay, good. So today I'm going to be injecting you today with my 3 syringes. I have my insulin, I have my tetanus toxide, and I have my serifumoxide. I can tell because they are all labeled with my tape, and so I already gathered all my equipment. I'm doing this because this is the doctor's orders. I've already performed hand hygiene for you, and I have consulted policy manual and determined the recommended guidelines for the IM injection technique regarding aspiration. So I have already provided privacy for my client by closing all the windows, and I prepared the medication from the vials already. So now I'm gonna go ahead and start the checklist. So my client is already in a sitting position. I'm gonna help assist my uncooperative client in case anything goes wrong. I can help them ease their pain, so please relax, everything will be okay. I selected a site where it's free of skin lesions or inflammation or swelling or tenderness, anything like that, and nothing that was used like very frequently. So this is where I'm gonna go ahead and inject. I'm gonna go ahead and apply clean gloves, and then I'm gonna go ahead and clean the site with a wet antiseptic swab. So I'm gonna go ahead right here. I'm gonna go outward about 5 centimeters. Okay, I'm gonna transfer to my non-dominant hand, and I'm gonna go ahead to allow the skin to dry prior to injecting medication. And now I'm gonna go ahead and I'm gonna prepare the syringe for the injection. So I have my tetanus toxoid. So I'm gonna go ahead and remove the needle cover. And I'm going to discard without infecting the needle, and discard it into my sharps. Alright, ma'am. Now I'm gonna go ahead and I'm going to take caution to avoid dripping medication, and I'm now going to go ahead and use the Z-Track method to fill in the 0.5 tetanus toxoid. So I'm going to use the ulnar side of my non-dominant hand to pull the skin approximately 2.5 centimeters to the side. So I'm going to put right here. And I'm gonna go ahead and inject. I'm gonna wait 5 to 10 seconds after the injection, and then I'm gonna go and hold the barrel of the syringe steady with my non-dominant hand. Okay, and then I'm gonna aspirate by pulling back on the plunger with dominant hand. Alright, now I'm going to go ahead and withdraw the needle, and then I have an alcohol pad. Just gonna apply pressure at the site with my dry cotton, and then I'm gonna go ahead and tape that to my client. gonna go ahead and put my syringe on lock so it can no longer be used. There we go, and I'm gonna discard it into my sharps. Alright, now I'm gonna go ahead and remove and dispose of gloves and perform hand hygiene. I'm gonna document the date and time that the medication was given and all relevant information, and assess effectiveness of medication at time it was expected to act. And now I'm gonna go ahead and do the next injection. Alright, now I'm gonna start doing the subcutaneous checklist. So I've already done everything with the privacy and hand hygiene, so I'm just going to continue on. And so my client, I'm going to go ahead and clean the site with an antiseptic swab. Once again, I'm going to go ahead and do it right here. I'm just going to start in the middle and then just go out 5 centimeters. Okay, and then I'm gonna go ahead and place it into my 3rd and 4th finger of my non-dominant hand, and then I'm gonna go ahead and get my syringe of my insulin. So here's my 0.3 of insulin. I'm going to go ahead and apply my gloves. While I'm waiting for the antiseptic to dry, I am going to go ahead and remove the needle cap, and I'm going to pull it straight off to avoid contaminating the needle by the outside edge of the cap. I'm going to dispose into the sharps. And so now for the injection, I'm going to grasp the syringe with my dominant hand and hold between the thumb and fingers, and with my non-dominant hand I'm going to go ahead and pinch the skin at this site and do it 45-degree angle. And so here we go. Right, I've injected it. Now I'm going to go ahead and remove the needle slowly, pulling it while depressing the skin with my non-dominant hand. I'm going to discard into the sharps, but first I'm going to go ahead and lock it so it can't be used anymore. Alright. I'm going to gently wipe with a dry, sterile gauze. Okay. I'm gonna go ahead and tape it to Miss Juice. And now I'm going to go ahead and remove my gloves again and perform hand hygiene and document date and time when the medication was given and all relevant information. I'm going to assess effectiveness of medication at time it was expected to act. Thank you. Alright, now I'm going to go ahead and do the last one. This is the skin test. So what I'm going to do now is going to go ahead and apply my clean gloves again. I'm going to go ahead and clean the sides. I'm going to make sure that it is at a place that is not tender or inflamed, swollen, anything like that. I'm just going to go like that. I'm going to let that dry. Now I have my Seraphim oxide right here. So I'm going to go ahead, while the antiseptic is drying, I'm going to remove the needle cap and I'm going to expel any air bubbles from my syringe. I'm gonna grasp the syringe with my dominant hand close to the hub, holding it between my thumb, forefinger. I'm gonna go hold the needle almost parallel to the skin surface with bevel of needle up. And now I'm gonna go ahead and insert. I'm going to go ahead and inject. I'm gonna go ahead and pull the skin with my non-dominant hand until it is taut. I'm going to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. Okay, alright, it is injected all the way through. I'm going to go ahead and stabilize the syringe and needle, and I already injected the medication carefully and slowly so that it produces a small wheal on the skin. I'm going to go ahead and lock it now. I've already withdrawn my needle quickly, and at the same angle it was inserted. I'm going to go ahead and dispose of the syringe and the needle into the sharp container. And I'm gonna go ahead and discard my gloves. I'm going to circle the injection site where the little pump is. Circle, alright. And I'm going to observe for any redness or inflammation in the skin or induration. And so now I'm going to go ahead and write the name of the medication. So there was sulfuric oxide, the day was 4/21, and the time, it is 2 a.m. and I'm going to write my initials as my signature, and I'm also gonna go ahead and write the time the skin test will be read. So 30 minutes after would be 2:30 a.m. Alright, now I'm gonna go ahead and document all my findings, and I'm going to go ahead and assess for any signs of allergies from the medication. Thank you so much for cooperating with me. I hope you have a great day. I'm going to go ahead and perform hand hygiene again.